Respiratory Physiotherapy. Introduction to the module. This module examines the techniques that a respiratory physiotherapist uses and the respiratory diseases that can cause the conditions that require them. Topics to be covered. Introduction to the respiratory system. What is respiratory physiotherapy? Respiratory diseases. Respiratory physiotherapy, assessment. Respiratory physiotherapy, treatment methods and interventions. Introduction to the respiratory system. All body tissue needs access to oxygen so that it can metabolize and release energy as it is required. Part of this metabolizing process involves the release of carbon dioxide, which needs to be removed from the body and can cause a toxic reaction if allowed to remain in any quantity. With this in mind, the primary purpose of the human body's respiratory system is to deliver oxygen taken from the air and dispose of the carbon dioxide that accumulates. This natural act is defined as respiration and consists of 4 distinct stages. 1. Ventilation. 2. External respiration. 3. Gas transport. 4. Internal respiration. The respiratory system controls 2 stages of respiration, ventilation and external respiration. Ventilation, this is the transportation and movement of air in and out of the lungs. External respiration, this is the act of diffusing oxygen from the lungs to blood and carbon dioxide from the blood to the lungs. It is achieved by the air being drawn into the alveoli, air sacs in the lungs, where gas exchanging is progressed. The process can be affected by any degradation in the tissues or muscles. Gas transport, this describes the movement of oxygen and carbon dioxide to and from the lungs via the blood flow, which is powered by the cardiovascular system. Internal respiration, this is a process where oxygen moves from blood to the cells, and carbon dioxide moves from cells to the blood. A healthy cardiorespiratory system has the natural ability to deal with the extra demand for oxygen that is needed during exertion or illness. Heavy breathing or exhaustion during moments of rest are symptomatic of a problem. Lung and heart diseases typically erode the reservoir maintained by the system and affect everyday activities and functions. What is respiratory physiotherapy? The main objective of respiratory physiotherapy is to assist and support clients who have disorders with any of these respiratory functions or breathing difficulties. It is often prescribed a specific course of treatment for those with diagnosed heart and lung diseases. Diseases directly affecting the respiratory system are quite common worldwide and have led to increased mortality and morbidity cases. They remain the most consistently used reasons for UK patients to consult with their local healthcare professional. According to the British Lung Foundation, around 12.7 million people in the UK, about 20% of the population, have a history of asthma, COPD, chronic obstructive pulmonary disease, or other respiratory illnesses. Respiratory diseases. A typical respiratory disease causes the airways or lungs to be negatively affected in some way. Whilst all severe lung diseases, known as chronic pulmonary diseases, are usually characterized by breathing difficulties, they can also result in non-pulmonary effects, affecting a person's quality of life in other ways. Purely in terms of significant respiratory issues, these diseases can be sorted into 2 types. 1. Obstructive. 2. Restrictive. It should be noted that some clients may have elements of both types in their condition. Obstructive diseases. An obstructive disease is usually recognized by symptoms that point to obstruction or resistance to the body's air channels or flow. This can either be a temporary condition, swelling or inflammation, or occur due to internal damage to the airways or lungs. Many obstructive diseases have long-term effects and may need lifelong treatment, in the worst case, with regular examinations and treatments by healthcare professionals. The most well-known obstructive diseases are chronic obstructive pulmonary disease, COPD, chronic bronchitis, emphysema, asthma, bronchiectasis, cystic fibrosis. Restrictive disorders. A restrictive disorder is usually related to a degradation in the lung's breathing limit, otherwise known as its compliance. This may be due to a disease affecting the lung's functionality, the pleura, lung membranes, chest wall, or other neuromuscular components. This means that although they primarily differ, both restrictive and obstructive may share similar or mixed symptoms and effects. Examples of well-known restrictive disorders are pneumonia, pleurisy, pleural effusion, pneumothorax, acute respiratory distress syndrome, ARDS, fibrosing alveolitis. There are several scientifically recognized lung disorders that cannot be satisfactorily categorized as being exclusively restrictive or obstructive. However, they need to be noted as they are significant and joint conditions that are routinely encountered in the UK healthcare system. They are lung abscess, pulmonary tuberculosis, bronchial and lung tumors, respiratory failure not caused by a diagnosed neuromuscular disease. Respiratory physiotherapy, assessment. A psychotherapist practicing in respiratory physiotherapy needs to gather data in order to perform a full assessment of the client. This is achieved by interviewing the client and reviewing their medical history. Accurate assessments are essential to ensure that any problem is fully understood and that measurable treatments are able to be applied. An assessment process must be continual, and the interventions must adapt according to the progress or lack of it. Full assessment performed during respiratory physiotherapy typically divides into 3 distinct stages: information gathering, subjective assessment and objective assessment. Information gathering. The first stage of performing any accurate assessment on a client consists of collecting any current and relevant information that comes from verified medical and welfare records. This includes the results of a blood test, X-rays, etc. Any accompanying doctor's notes or documented observations are also helpful. If the client's circumstance means that there are little or no records to consult, then most of the assessment's conclusion is taken from the second and third stages. According to the facility they are received from, the format of records may vary, but they should all include client details and medical history or summary. All professional medical summaries are expected to include the following pieces of information: a description of the client's problems, as seen from a medical perspective and examination. A full summary of the client's medical history, which includes instances of required surgery, along with previous injuries and illnesses. A current listing of the prescribed medications that the client is taking and any medicinal allergies that they may have. A record of any potentially hereditary conditions that other family members may have had in the past or present. Other appropriate medical information should be sourced wherever possible, but only if they have relevance to their current issues. Subjective assessment. A subjective assessment is held to ensure that the previous medical information is verified and confirmed and highlight any further valuable information in the forthcoming treatments. Open-ended questions should be asked at this point to encourage interaction and embellishment from the client. An interview should consist of queries such as, "What seems to be the main problem?" or "Where do you feel the most pain or discomfort?" An active respiratory or cardiorespiratory disease generally displays 5 symptoms. 1. Constant coughing. 2. Unexplained breathlessness. 3. Rattling or wheezy breaths. 4. Distinct chest pains. 5. Mucus or blood being expelled from the mouth. Objective assessment. The final stage concludes the assessment with a complete and thorough physical examination of the client, along with other results from tests or other ongoing medical observations. The ABCDE approach, which is often the primary technique used by first aid personnel and medical professionals in an emergency, can help determine any abnormal respiratory conditions. This uses a methodical series of examinations that can be applied to any client. The physiotherapist closely observes airways, for any obstructions or restrictions. Breathing, for any noise or erratic rhythms. Circulation, for any blood clots or numbness. Disability, for unresponsiveness or sensory deprivation. Exposure, for checking all aspects of body temperature and essential functions. Respiratory physiotherapy, treatment methods and interventions. Manual techniques. Experienced physiotherapists can use manual techniques to help those with respiratory conditions clear their airways to a greater degree. This typically involves applying some force to the client's chest wall. Differing types of treatment include percussive, clapping a hand to the chest. Chest wall vibrations, shaking, tapping, or compressing the chest wall during breathing. Direct chest compressions, forceful compressions at the end of a breath to move blockages. Rib springing, gradual compression to the chest followed by a sudden release. These methods help release and expel any secretions built up in the chest area. Independently performed breathing techniques. Active cycle of breathing techniques, ACBT. This is a specialized technique to help an individual quickly clear their lungs of secretions or blockages. It is designed to apply compression and collapse movements slightly downward from the lungs and breathing muscles, stimulating the airflow and making it more capable of clearing any obstructions or unwanted material. The technique includes 3 primary cycles: BC, breathing control, TEE, thoracic expansion exercise, and FET, forced expiration technique. Breathing control. The client is encouraged and helped to breathe using their lower chest muscles, whilst relaxing their shoulders and upper chest area. The physiotherapist can assist them by placing their hand over the diaphragm and applying a little pressure. Thoracic expansion exercise, a deep breathing exercise, DBE, encourages slow and controlled breaths being taken by the nasal passages. Each breath should be deliberated with a 3-second delay between each one. Forced expiration technique, a vital part of the ACBT and typically entail at least 1 or 2 forced expirations or huffs being made by the client with additional BC. A huff occurs when an individual blows out air with some forcefulness and accompanying noise. This kind of action can effectively move chest excretions towards the mouth and clear them from the upper airways. Whilst coughing can clear any secretions from bronchial conditions, it can be painful and tiring. However, a single and concentrated huff from the lung can be just as effective and less exhausting. Device-dependent techniques. Positive expiratory pressure device, PEP. This form of therapy utilizes a face mask or mouthpiece that contains a one-way valve. The main objective is to apply an airflow or resistance as the client breathes out, which creates a positive airway pressure and encourages the movement of mucus or gases from small areas or the lungs to a larger airway. In essence, PEP therapies actively boost the body's natural airflow through its channels, improving the shifting potential of the ventilation distribution, leading to more air being accumulated to push or expel secretions. This may be subsequently followed by huffs and other breathing techniques to provide final expelling. Summary. This module has covered the following points. The human body uses its respiratory system to extract oxygen from the air and dispose of the produced carbon dioxide. The term ventilation refers to the movement of air in and out of the lungs. The presence of respiratory diseases or conditions can affect the functions and performance of the body's airways and lungs. Most respiratory diseases and conditions are classified as being either obstructive or restrictive types. A professional assessment in respiratory physiotherapy is separated into 3 distinct steps.